We've got quite a few people to hear from today, so we're going to have a limit of 4 minutes for each individual. Now, we do have your written testimony, so as legislators always say, you don't have to read the entire document to us, so hit the highlights, tell us what your priorities are and why it's important to you. We'll also have Lee Keck play a little role as a timekeeper, and she'll let you know when you've got 30 seconds left, and she'll let you know when to stop. I think many of you probably have the list in order of the individuals who are going to be speaking today. We're going to do this by commission, and after each commission, we'll go through all of the conferees, and then after we finish each commission, we'll take a few minutes and see if anyone from the agency side has any questions for any of those particular presenters. And then we'll move on to the next commission. So feel free to just sort of bring yourself up in order. If you don't know and there's a lag, we'll kind of call out the name of the next presenter. But we're going to start out today with Sean Sullivan from Midland Care Connection. He'll be followed by Kylie with Leading Age. Thanks, Sean.
Thank you, Madam Secretary, and I'll try to set a good example for brevity here. So Midland Care Connection, President and CEO, appreciate the opportunity to talk and to present our budget requests or priorities as you all consider your agency request. Three things just to mention. Number one is just a profound thank you for your all support of various programs in your agency. For us and everything we do, your all support of PACE has been tremendous, whether that's been helping us open new programs or expand new places around the state, or with the sister agencies supporting awareness building of what this program is. And it's really, over the last number of years, it's really, momentum has grown to where it's becoming a thing now and becoming a much larger program, and one that benefits older adults across the state and helping them stay at home where they want to be. So first is a thanks for that. Second is a thanks to Deputy Secretary Brown and others for helping us establish what's known as the Capable program in 2 different places as a pilot, and we look forward to seeing that grow over time. And third is your support of the nutrition program. So 2 things I want to briefly mention as a request are PACE and nutrition. For PACE, we've done pretty well between the 3 PACE programs. I'm speaking on behalf of the other 2 as well, on drilling into the need for support for increasing rates over the last several years. And you all and the governor have been very gracious as well with your support of that, and have tried to do our best to get them to understand the acronym of AWOP, the amount otherwise would have paid for other Medicaid programs. And our request for this next fiscal year is the same as it has been. It's kind of a copy and paste of staying at the 90% level of the amount otherwise would have paid for other Medicaid programs. Again, we've been very thankful to be at that level the last 3 or 4 fiscal years, state fiscal years, and we would welcome the ability to continue to remain at that amount compared to the CanCare MCOs. And I'll stop myself from getting into a laborious explanation of the AWOP for everybody else in the room, because I know you guys know what that is, but it's a good story and a good one to fall asleep to. The second thing is on nutrition programs. Again, thank you for the support of enhancement in the current fiscal year, and the governor's support of that as well. Just have a brief request on that. And I know there's, I believe, a request for applications going out in the next week or 2 for the state general fund enhancement that went into effect July 1 for $2 million to try to address where the waiting lists are for nutrition programs and the Meals on Wheels program. Our request, or my request, is that you work with the AAAs to understand what the waiting list needs are, because I'm not sure there's a great understanding of what that is across the state and through the 11 PSAs or AAA catchment areas. Just looking at our own situation, we typically, the last couple of years, have provided about 1,200 meals a day through our nutrition program in the 3 counties that we serve. And last year, late last year, we were serving about 15,000 meals a month to home delivered meals for those that are kind of considered the most needy within that program. As the funding needs have been challenged and the demand has gone up, we've had to take that down to where, as of end of June, we were providing about 9,500 meals a month. And we're trying to get to a point of about 8,100 meals a month by October, when the new fiscal year starts. So That may change if we receive funds through the grant process that Cody and Commissioner Anderson or others are letting out here in the next few weeks for this fiscal year. Again, that may change, but would ask that you all work to collect what that data looks like, and then if appropriate, submit an enhancement request. And if you don't have the ability to do that because of the timing, not having that data, or doesn't fit within the priorities, then at least making known what the needs are so we can take that advocacy and run with it within the legislative session. So again, thank you all for what you all do and your wonderful staff, and appreciate your all support. So thank you.
All right. Good afternoon, Secretary Howard and all others in attendance today. I'm Kylie Childs, Director of Government Affairs with Leading Age Kansas. We're the state trade association for nonprofit and other mission-driven aging services providers. For fiscal year 27 for nursing facilities, we'd like to continue the statutorily required rebase and then look at how we can tier some of the add-ons we've been receiving over the last few years, such as the one for Medicaid, as well as one for behavioral health, and make those permanent into our rate structure to offer some predictability and planning for providers versus 1 year fixes, year-to-year fixes. And then the other thing we'd like to see is how we can adjust incentives in the real and personal property fee to reflect actual costs, as those have inflated and adjusted over time, but the actual rates themselves have not come up to be where they are with actual costs. In terms of the home and community-based services frail elderly waiver, we'd like to see sustainability in the rates, especially with personal care services being at $30 an hour, with the potential for some inflationary adjustments, so we're not always playing catch up for the home and community-based services waiver, as well as any funding that is needed to avoid any wait lists for the frail elderly waiver. We're really looking at what can we do to ensure people are continuing to age in place as much as possible. And then for PACE providers, we are looking to continue rebasing PACE providers at 90% of the AWOP, as Sean referred to. I also won't get into what AWOP is. And as you heard Sean talk about, we're also supporting additional funding and data to support senior nutrition programs and reducing any wait lists across the state. So there's more details in our written testimony, but that's all I have prepared for today. So thank you for the opportunity. I'll stand for questions at the appropriate time.
Thank you, Secretary Howard and KDADS leaders and staff for the opportunity to provide testimony today. As one of the many engaged stakeholders in this budget input hearing, I'm Larry Vanderwig. I'm the Director of Regulatory Affairs and Preparedness with the Kansas Hospital Association. And I'm grateful to have a couple minutes to highlight a few points of our written testimony on behalf of the 124 member hospitals that make up the KHA. Thank you also for the partnership that our association and membership share with the KDADS in caring for the health of Kansans. As hospitals across the state are seeing the impacts of the aging population and their care delivery, they are also struggling with increasing financial challenges. In Kansas, 67% of our hospitals had a negative operating margin going into 2024, and our hospitals' average cash on hand sits at 62 days, while the national average is 218. Meanwhile, in the last 3 years, hospital operating expenses have increased by more than 35%. Today, our Kansas hospitals are relying on more than $78 million of additional city and county tax support while shouldering $1.1 billion of uncompensated care. This is leaving more hospitals vulnerable to service line and facility closures. I think these are challenges that probably all the stakeholders in the room face. Kansas hospitals continue to struggle with the cost of caring for behavioral health and geriatric patients who no longer need care in the hospital but cannot be discharged to home due to limitations in acceptance by long-term care facilities. Hospitals call these avoidable days. In Kansas, hospitals reported a total of more than 138,000 avoidable days, costing more than $110 million. These expenses contribute significantly to the $1.1 billion in uncompensated care. This also jeopardizes the daily availability of beds for patients in medical crisis, awaiting admission from the emergency department or a transfer to a facility with a higher level of care. In 2023, the state, through KDADS, began providing funding for observation time and transportation costs for behavioral health patients waiting for an involuntary bed at a state facility. We are very grateful for that support and would like to build on this and explore reimbursement for the long-term care avoidable days, similar to the behavioral health support. We share your excitement to construction of the South Central Regional Medical Center, Regional Mental Health Center, and the opportunity to open additional behavioral health beds. We know all too well the challenges of staffing hospitals, and we encourage the agency to do what is needed to keep the beds staffed at Larned and other existing facilities. To shift staff and thus beds from one facility to another would be detrimental to the access to care throughout the state. We all know how much Medicaid has been discussed recently in our country. Here in Kansas, there have been efforts to increase Medicaid rates to long-term care providers. Those increased rates assist hospital members provide long-term care, but more importantly, they support our long-term care partners. Having strong long-term care partners are necessary partners in providing care in our communities, and it is imperative for KDADS to continue enhancing Medicaid rates and add-on payments to those providers in Kansas. Training and maintaining a workforce is vital to all of the stakeholders in this room today. We appreciate the opportunity to work with KDADS to continue to find ways to train and share nursing and other staff for both hospitals and long-term care. Again, thank you for the opportunity to speak today, as well as submitting written comments, and I'm available for questions in the future. Thank you.
Good afternoon, Secretary, staff, and colleagues. My name is Linda Mowbray, and I'm President CEO of the Kansas Healthcare Association and the Kansas Center for Assisted Living. We represent long-term care continuum across the state of Kansas, 270 members, both for-profit and not-for-profit members. I'd like to start today by saying that, we are very grateful for the work the agency's done, for the work that the legislature has done to recognize and to try to stabilize our adult care living options in the state. That's been a huge lift, and you all have been there. The state giveth, and you all, the state, have to doeth, and we really appreciate all the effort that you've put in for that. We do have some growing concern, though, that between the OBA, the One Big Beautiful Bill, and also budget concerns coming down, that we're going to need different kind of support, additional support. As you all know, Medicaid's the lifeblood of payment and reimbursement for our nursing homes. It's becoming more and more relied upon for assisted livings as well. Right now, Medicaid is paying about 82 cents on the dollar for the care that's being delivered. Now, I know based on the cost reports and the formulas, it looks like we're getting paid actually more than our cost, but that's allowable cost. We're at about 105% of allowable costs. And so that doesn't really paint the picture of what it takes to take care of people and the true costs that are involved. So we want to explore some different rate methodologies that will get more to the heart of what does it actually take to take care of people. The last few years, we have had a Medicaid add-on, and that has kept nursing homes from closing, quite frankly. But we come back year after year after year and ask for that add-on. And what we're discovering is that that money needs to come into our facilities on a sustained basis. And this time we're really looking at it as Medicaid continuing capacity. If we want to have homes to continue to provide Medicaid care and Medicaid beds, then let's help them pay for that cost. And doing it in a tiered structure, so the more Medicaid you provide, the higher your daily capacity payment would be. And it would reward those providers who have taken that additional risk for those individuals on Medicaid. Also, with the behavioral health add-on, we too want to see a behavioral health add-on to acknowledge that, you know, it's not always high-tech nursing care that people need. Sometimes it's just somebody to sit with you, somebody to talk with you, somebody to recognize what's going on with you. So it's very important that we really have a way to capture what those needs are and to provide the care. Right now, the MDS does not capture that. I think one of the things we want to look at is not adding more money to the program, but what is the targeted investment to get the greatest return? Thank you for allowing us to make these comments, and we would love to participate with any other dialogue and roundtables. There are some additional comments in my testimony. Thank you.
Great. Good afternoon, Secretary Howard, members of the KDADS Budget Committee. My name is Haley Ordoyne. I am the state long-term care ombudsman. Many people I know in this room don't know what that means or what it is. So to expand upon that, many of you at KDADS understand that we are resident advocates for anyone who lives in adult care home settings. So long-term care, assisted living, home pluses, assisted living environments, stuff like that. And our ask relevant to the budget may sound just very simple. I understand the implementation of it is not. And that is for increased focus of funds and attention to increase state surveyors for these homes. I understand this has been a long-going conversation. There's been efforts to work and implement this in, but why? What we come across, what we see, we understand that there is a triage system already in place for surveyors to enter into a building. But in our experience, what we get called for is those instances where it's the little things, and the little things add up and they keep growing into bigger and bigger things that we try to come in, and our role is trying to resolve those issues. But when it's beyond our capacity and it's more of a regulatory issue, abuse, neglect, exploitation, that's where we call the KDADS team, call the surveyors and report to A&E. And we just seem to run into instances where, and I'm quoting directly residents that we serve, that they feel like they don't matter because they feel like it's not happening in a timely manner. So our ask would simply be for that. Like I said, I know it's not a simple ask, but we are here to advocate for that and also to be part of the solution that we can be. And we're happy to answer any questions and expand upon that at the appropriate time. So thank you.
Good afternoon. I'm Leslie Anderson, the Executive Director of the Kansas Association of Area Agencies on Aging and Disabilities. I represent the network of the local 11 area agencies on aging that serve all counties throughout the state of Kansas. Thank you, Secretary Howard, for the invitation to offer budget recommendations for the KDADS FY27 budget. The area agencies on aging are focusing on FY27 recommendations to strengthen a Kansans' ability to age in place with appropriate supports and services. Since 1973, when the Older Americans Act created the area agencies on aging, they have advocated for community-based programs and services as most people prefer to age in place and remain connected to their community. Through a variety of services complementing the Older Americans Act, the area agencies on aging support older adults, individuals with disabilities, and caregivers. The area agencies on aging support KDAD's request of a budget enhancement to reduce the likelihood of waiting lists that are causal to confusion, fear, and an unnecessary burden on hospitals and informal support systems. Since the waivers nor policy requires follow-up or case management for a person on the HCBS physical disability waiver or potential frail elderly waiver waiting lists, there is a lack of communication to identify needs or crises, and oftentimes a person is resolved to accessing services in an assisted living or nursing facility. Waiting list case management also maintains accuracy of the waiting list when this or other changes occur. This is why it is beneficial to add case management for individuals waiting to access the PD or frail elderly waivers. The area agencies on aging also support KDAD's request for community care coordination and advocate that the entire appropriated amount is allocated to vendors contracting for the administrative service. This will allow vendors to provide competitive compensation package for highly qualified personnel to provide quality, unbiased, and conflict-free coordination. Kansas can anticipate a growing number of individuals needing assistance as our population ages and requires more medication management, frequent hospitalizations, and a need for more complex care coordination. The recommendations from the area agencies on aging highlight the value of local partnerships vital to improving health outcomes, optimizing resources, and reducing fragmented care. We look forward to working with KDADS and our community partners to address the inevitable rising demand for services and aging trends in Kansas. Thank you again, Secretary Howard, and I'll stand for questions at the appropriate time.
I think that's it for our testimony from aging. Hey, folks are ready to move on here. Just before we move on to behavioral health, any questions from any of the KDADS team on any of the testimonies we just heard? Anybody have anything? You don't need to go back. Go ahead, Dave.
And we greatly appreciate our partnership with you all. As many of you know, I'm retiring at the end of the month, but we'll be fully engaged until then to deal with a lot of the pressing issues. I'm also keeping a list for the person who comes after me so that they'll be able to follow up with you after the first of the month. But in the meantime, if you need anything, please don't hesitate to reach out.
Thanks, Dave. Good opportunity to give a little bit of a farewell to Dave. He's accomplished a lot in a couple of years working with all of you. So thanks for all of your work, Dave. We will miss you as you head out into the next journey phase of your life. So I'm a little jealous. Any other questions from KDAD's team about any of the aging testimonies? All right. If not, we will go on. Oh, Andy. Yes.
Sean, you mentioned kind of doing a study around the sort of the need for the nutrition program. I think that our intention is as part of the RFP to have the AAA sort of produce some documentation around that. And then your request seemed to be sort of like, could we then turn that information over or publish that information in some way? Could you tell me just a little bit more about what your sort of vision is for an end product on that?
Yeah, Sean Sullivan, Midland Care Connection. We as nutrition providers don't really have access or a line of sight to what the nutrition waiting list needs are. Unfortunately, unlike maybe 10 or 15 years ago, there's not really a statewide association anymore. So we're just requesting that we have data shared with us as possible on what those are so we can go properly advocate for enhanced funding. Last year, we were able to get, the governor requested the 1 million, legislature added another 1 million on top of that. It's easier. The more data we have, the more justification we have, the more stories we can tell, and just putting meat behind what our requests are. So that would simply be it.
All right. Anything else from my team? All right. If not, we will move on to behavioral health. Now you can come back up, Des. So, okay. There you are. There you are.
Good afternoon, Secretary Howard, the KDADS team. Thank you for the opportunity. I'm Des Martins, President and CEO of Mirror. Mirror has been providing addiction treatment services in our state for over 50 years. Today's testimony will focus on that, although we do have reentry services and innovative prevention teams in our state. We serve primarily the uninsured, the underinsured, justice involved, and Medicaid enrolled Kansans. And for many, we are the last best hope. We offer services in brick and mortar in locations Shawnee, Lawrence, Topeka, Newton, Wichita, Medicine Lodge, Anthony. Additionally, we provide telehealth and medication-assisted treatment for individuals throughout the state of Kansas. I want to thank you for the block grant allocation. This is such a crucial need for agencies, Mirror and agencies like us. These funds provide treatment for people that are below 200% of the poverty level without insurance. And just last week, I heard a quick story of a gentleman who was 46 years old, starting using at the age of 14 when he was offered meth in his school, had been in and out of incarceration ever since that point, and for the first time was offered the opportunity to go to treatment. And today he's 20 months clean and sober, is in college, is a dad really for the first time filling that role and working a job. So just the opportunity for treatment really can make a difference. So that block grant is so appreciated. Thank you. We asked that $5 million be included in the state fiscal KDADS budget for continuing block grant enhancement for the uninsured and non-Medicaid eligible population. We also request an increase in our Medicaid residential rates for substance use disorder treatment services. Currently, that rate is about 38% below the average cost for service providers. We face the same inflationary costs, workforce, labor challenges that other providers face, and with other agencies receiving higher reimbursements, it's becoming increasingly challenging. Lastly, I want to ask for peer mentors and PCCM services to be unbundled from the per diem rate for residential care. A large body of literature demonstrates the effectiveness of these services. KDADS now offers certification for peer mentors and PCCMs, and we take advantage of that all of the time. It's made such a difference. So that there's value on this kind of service, and to unbundle that would help more agencies be able to provide that. So we request that peer mentoring, person-centered case management be unbundled, allowing clients to receive those services. Thank you.
Well, good afternoon. Thank you for having us. My name is Andy, and I'm with Breakthrough Episcopal Social Services, and this is...
I'm Trish. I'm with the Lotus House.
Yep, it's Tricia with the Lotus House, and we're here on behalf of the Kansas Clubhouse Coalition. And we are respectfully requesting your support in raising the statutory cap on the lottery vending machine funding that's used both for clubhouses and the crisis intervention centers. Just as a refresher, a clubhouse is an evidence-based community centered around the support for individuals with serious mental illness, helping individuals re-enter the workforce and re-engage in their communities, but importantly, improve their own well-beings. There are over 370 clubhouses in 32 different countries. They offer membership for free. It's voluntary and it's for a lifetime. It's a safe place for people to belong with meaningful work and meaningful relationships. Members and staff work side by side towards recovery and wellness, using work as a therapeutic intervention. We also offer support in employment and education, housing, as well as care coordination. We are not a drop-in center, and we are not medical or clinical. We are a community of purpose and support. Thanks to KDADS, over the last 6-7 years, we've expanded from one accredited clubhouse to 4 accredited clubhouses, with 2 more on their pathway to becoming accredited through the Clubhouse International Accreditation process. These programs are delivering real-world results. We have about 1,000 clubhouse members statewide, where our employment rate's right around 42%, and we see a 90% of reduction in long-term hospitalization. And this is where I'm going to pass it off to my colleague.
I've been a member of the Lotus House for a little over a year now, and because of that, I have not had to been hospitalized at Stormont West or Vallejo. I typically work in the wellness unit at the clubhouse, and that unit takes care of the kitchen, and we make all the lunches that we serve for only $1. The clubhouse has helped me with my mental health, but it's also helped me with my social and my shyness. So it's just been a great all around, and I've made a lot of friends there. It's been a lifesaver.
And you're standing in front of a group of professionals and delivering perfectly. Great job. As you can imagine, the demand is great. Like all of you have expressed, the need is big. We're looking to expand this model throughout the state of Kansas. We have a great startup group in Lawrence. We also looked in Dodge City, Hayes, and Great Bend, where there's roughly 20% of the population has a mental health diagnosis. So we know that it could make a huge impact. So we're asking for increased funding to continue not only to expand the model throughout the state, but increase our capacity to reach more in our own communities that we are already in. I don't know if I mentioned this, but we are in Wichita, Hutchinson, Newton, Salina, Topeka, and Olathe. So thank you all for your time, and we are open to questions when the appropriate time comes around.
Thank you.
Good afternoon. My name is Michelle Ponce. I'm the Associate Director for the Association of Community Mental Health Centers of Kansas. Our association represents all 26 licensed community mental health centers across the state, who are all now fully certified CCBHCs as well. The CMHCs are required to provide services to all Kansans needing them, regardless of ability to pay, and they are the safety net for behavioral health services. Today we'd like to highlight two priorities. The first being funding for and underinsured. In recent years, the centers are serving more and more and underinsured patients throughout Kansas, and their need for higher intensity services continues to increase as well. For FY26, the Kansas legislature approved an increase of $4 million for CMHC state contract funding that helps to support the services to those underinsured, though that was later reduced. For FY27, we're requesting a reinstatement of that $4 million for CMHC contract funds. Our second priority is related to workforce development. In response to the workforce shortage across the state of Kansas, we helped to establish the Kansas Behavioral Health Center of Excellence not quite 2 years ago today. Focus of the center to date has been really on supporting applied learning opportunities for behavioral health students, expanding training and education programs, and establishing new programs to increase the number of individuals entering the workforce. These are multi-year initiatives. For FY26, the legislature approved funding in the amount of $7.7 million, though that was also slightly reduced. For FY27, we're requesting continued funding at that $7.7 million level so we can continue the work that we've begun. Thank you for the opportunity to present our request for budget items today. I'll be happy to answer questions if you have them. Thank you.
Hello, my name is Stuart Little with the Behavioral Health Association of Kansas, Drug and Alcohol Treatment Providers Prevention Programs around the state. I want to thank the Secretary, Commissioner Brown, Drew Adkins for all the work that you all have done with those of us who work on the behavioral health side. Emphasize a couple of points, kind of acknowledging we're all still living in this world of figuring out what federal action is going to have impacts in terms of both funding and policy. I don't envy the work you all have to do, but it also kind of elevates the significance of what the state can do as well. So no surprise, folks in the behavioral health world coming in talking about funding for the uninsured and workforce. I'm going to do the exact same thing. there has been since 2022, 23, in the neighborhood of $5 to $6 million added each year through the legislature to enhance treatment services for the block grant eligible population. And that's spread over the block grant providers. And the more money that goes into that helps more providers all around the state, deals with, addresses geographic distribution, those kind of things. So we're the 3.5 million that was added in the 2025 legislative session. We are requesting that you add into the budget 5 million to get back to that kind of baseline that we've lived with for 4 or 5 years. I would also note that there was $2 million put in for workforce issues in the behavioral health universe, and that that is helpful for non-CCBHC providers. And we would love to see that elevated to $4 million, go through that same grant process, because in particular investment in workforce development, you get folks in the door and you've got to be able to sustain that. And I think everybody has those same kinds of issues. I would, at the last point, kind of note that the budget process itself has changed so much that there's a dynamic that everybody's trying to work out, those of us that work in the building, about no longer being in the governor's budget and what that means for dealing with the legislature. I would note that I would encourage the agency to be a little more liberal in what you put into the budget, because that keeps more of us alive, frankly, and it puts more things on the table for all of us who have needs going into the legislative session. So happy to answer questions.
All right, that's all we had on the behavioral health side. Let me turn again to my team and see if there's any questions, points of clarifications, things you'd like to know more about. Right, I think that was, yes.
Des, I was curious, you mentioned the Medicaid residential rates and they're currently at 206. Do you have like a magic number you'd like to get them to? All right, for those of you online, she said parity with the block grant.
Which is 225. All right, anything else before we move on to our longest list of conferees today? This would be Long-Term Services and Supports Commission, starting with Monty Kaufman. Monty, maybe our first virtual testimony today.
Secretary, thank you. And like others have said, our appreciation to you and Deputy Secretary Brown, Commissioner Hayden for this part. You have my written comments and input. I promise to be briefer than Mr. Sullivan was. The first ask I have is the consideration for HCBS rate standardization. Over the last 3 years, since 22, nursing facility rates have gone up 50% during that time. And then 2 years ago, the legislature moved the FE HCBS waiver rate, agency waiver rate, up by 50%. And boy, that's really, while a good thing, has caused some real challenges in the field when it gets to equity and equal treatment for the same work, and attraction and retention of workers as well. So we would appreciate steps, what could be taken towards standardization of the HCBS rates. Two of my other comments that I've submitted have to do with what we believe are initiatives and projects that have shown their ability to reduce Medicaid costs for persons in the area of hospitalizations, emergency room visits, and institutional placement. And in my testimony, Madam Secretary, I just asked for consideration of emphasis on the remote patient monitoring program, and then funding starting in 2027 for the Nursing Home Without Walls project. Thank you for your consideration and for the time to share input today.
I think next we have Sarah Pearson with Hetlinger. Is Sarah here? Or online? No. All right. If not, we have Steve Sandoval with Southwest Developmental Services.
Thank you. Appreciate the opportunity to provide input into the budget process. My name is Steve Sandoval. I am President and CEO for Southwest Developmental Services. We are a CDDO in Southwest Kansas. We cover 18 counties. We have an office in Garden City and an office in Great Bend. What I'd like to ask today is specifically for an increase in CDDO admin funds by $3 million, all funds. This is 1.7 million in SGF and 1.3 in federal match dollars. So the CDDO allocation prior to 2013 was an annual snapshot, and then you basically took that population and divided it out into the total available dollars. 2013 was also around the time we were implementing CanCare. We were migrating our data system from an old BASIS system to CAMUS. Then we had turnover in the state administration. We had turnover in KDADS. We ended up keeping that snapshot for the next 12 years. And so in FY 2026, we were in efforts with KDADS trying to update that allocation or reset it. And what we found out is growth had hit us pretty hard. So reallocating that, many CDDOs were going to have to take a cut in order to address the growth. And for us, SDSI in Garden City or Southwest Kansas, that was to the tune of about $120,000. Very tough to do. And you have also the increase in the cost of doing business. I didn't know what I was going to do. So we just need to be able to reset. And so we need these funds to be able to reset that allocation, move forward, continue on with the modernization efforts, and make the system better. Also, I would like to ask for 1 million restoration of state aid. This is funds that we use for non-medicated supported individuals in the IDD system. And I think it was an oversight. I think some miscommunications. It was not intended to be a one-time funding. It was intended to be an ongoing restoration. And so the legislators I've talked to, that was confirmed. I think we have an opportunity to restore that, to put that back into the system, but we'll have to work together to do that. So I'd stand for any questions at the appropriate time.
Good afternoon, Secretary Howard and the KDADS team. My name is Megan Shreve, and I am the acting interim executive director at InterHab, the IDD Association in Kansas. And I just want to first off, thank you for your leadership and for letting us be a part of this important conversation. And an extra thanks for the very intense subgroup process that we went through earlier this year. It was a lot of work from a lot of people in this room, and it's greatly appreciated. InterHab and our member organizations are here today because we share the same goal, a Kansas where every person with intellectual and developmental disabilities has the same chance to live, work, and thrive in their own community where they want to be. We've made progress, especially on the wait list, but progress must continue. And we don't have the provider capacity to serve every person coming into services and continue that wait list process. Since FY23, our rates have gone up just 1.55% total. That's less than 0.5% a year. While the cost of staffing, transportation, workforce, housing continues to climb at a much faster rate. The math just doesn't work. Every new slot must come with the resources to support it. Otherwise, we risk overpromising and under-delivering rather than building the essential capacity needed across the state. Secondly, targeted case management is the backbone of individualized services. But current rates and billing structure make it nearly impossible to recruit and keep skilled case managers. Without them, families wait longer, needs go unmet, and quality suffers. We need a true inflation adjustment, a billing structure that works, and training support so we can keep good people in these roles and build the capacity needed to support the IDD modernization efforts. Third, as Steve just discussed, CDDO administration funding needs to be stable and adequate. The funds added last session mentioned the $1 million in state aid restoration and the CDDO allocation of 2.4% were meant to be ongoing, but again, through some miscommunication, were treated as one time. These funds are essential for onboarding, waitlist reduction, and the daily work of connecting people to services in their communities. Fourth, behavioral health. Complexity continues to rise, yet service is lacking. Grants do help, and we appreciate that, but they're not a long-term fix to the complicated issues in the behavioral health crisis in the IDD community. We need permanent investments, which include more training, better coordination across the state, crisis stabilization in home communities across the state, and proven models like START. We also have to address the basics: employment choice, transportation, and housing. Efforts to rebuild and reestablish employment programs hinges on fixing the funding rates and billable time. Providers need a model that reliably covers costs, and preferably a model that pays well or better than congregate settings and services. Transportation remains to be one of the biggest barriers to work, healthcare, and community life. And without affordable housing, especially in our rural and underserved areas, independence simply just isn't possible. We know that this is a long list and we have a lot of work to do. InterHab is ready to keep working side by side with KDADS and our other stakeholders in this room. We do continue looking forward to working with all of you, and thank you for the opportunity to share today.
Hello and good afternoon, Secretary Howard and KDAD's leadership. It's good to see you all again. My name is Lola Cornell, and I serve as the Advocacy Coordinator for the Kansas Council on Developmental Disabilities. We appreciate the chance to speak with you today and to continue our partnership with KDADS.
And I'm Whit Downing, Vice President of Policy and Programming for KCDD. We are proud to be the statewide advocacy organization for people with intellectual and developmental disabilities and their families across Kansas.
First, we sincerely thank you for your leadership during the 2024 and 2025 legislative sessions. Your efforts to address the IDD waitlist have not gone unnoticed. The additional 200 waiver slots and a new cap of 4,000 people are major steps forward, and the disability community is truly grateful.
That said, nearly 4,800 Kansans are currently waiting on the IDD waiver waitlist, many for 8 to 10 years for life-sustaining services like in-home support and day programs. These are not luxuries, they are basic needs. And as many of you know, I was on the IDD waiver waitlist for 8 years here in Kansas. At KCDD, we believe that with the right investments and collaboration, Kansas can eliminate the IDD waitlist within the next 3 years. That's why we are urging KDADS to request funding for 500 additional waiver slots and lower the waitlist cap from 4,000 to 3,500. This change could make sure that the list is reduced and not just managed on paper.
We would also like to see full funding and support to launch the Community Supports Waiver. This waiver was recommended by the 2022 Special Committee on IDD Modernization and is more necessary than ever, especially as our current waiver remains under a federal corrective action plan. We recommend allocating $10 million to support the first 500 participants.
But funding alone isn't enough. We need better systems. And so we're asking KDADS to invest in two important modernization efforts. One, a tiered waitlist system that prioritizes people based on their level of need. Right now, over 60% of those on the waitlist are under 22 and not seeking services until after graduation. A tiered system would help match people with the right supports at the right time. And two, a two-way communication platform so individuals and families can view their waitlist status, update their information, and directly communicate with KDADS and their CDDO. According to the KU waitlist study, one of the top reasons people are removed from the waitlist is simply because they cannot be reached.
Even when people finally receive waiver services, they often face another barrier: no one to provide the services. In many parts of Kansas, especially in rural communities, families are desperate to find a direct support professional or direct support worker. We are in the middle of a workforce crisis, as many of you know, and it's been this way for years. That's why we are asking KDADS to support the Kansas CARES Act in the 2026 session. This bill lays the groundwork to strengthen the disability workforce through better training, career ladders, livable wages, and access to benefits like health insurance and retirement. The bill offers smart and tested solutions. Many of them are based on research KDADS has already funded through KU and is supported by national experts. With over 25,000 direct support workers across the state and a 50% turnover rate, investing in this workforce has never been more urgent.
Thank you again for your leadership. We're very proud to stand with you in this work, and we are happy to answer questions at the appropriate time.
I think next we have Dan Goodman. I think Dan is virtual. Are you there, Dan?
I am.
All right, go ahead. Thank you for being here.
Thank you. My name is Dan Goodman. I'm the Executive Director of Kansas Advocates for Better Care. Thank you, Secretary Howard, for allowing the opportunity to provide input. Kansas faces urgent challenges in long-term care as the population ages. By 2030, 1 in 5 Kansans will be 65 and older. Without targeted action, older adults will encounter long waits for services, reduced protection, and lower quality of life. KABC offers 5 targeted cost-conscious recommendations. Number 1, to fully fund HCBS for elderly waiver. Projected shortfalls of $27 million in 26 and $70 million in FY27 could trigger a wait list, worsening Kansas's already low national ranking and will reinforce premature nursing home placement. Investing in adequate funding will delay and divert many from costly institutional care settings. KABC recommends a request for full funding to avoid the FE waiting list. Number 2, to implement community care coordination for Medicaid waiver populations. Despite a $20 million commitment, this service remains unimplemented for FEPD and BI waiver recipients, lacking case management services to troubleshoot care and connect resources. Prioritizing this implementation would improve access, outcomes, and could help those on an FE waiver wait list locate interim support. We recommend the implementation of this service without delay. Number 3, to strengthen KDAD's survey capacity, vacancies remain near 50% with wages far below market rates. This factor delays inspections and weakens resident protection. Increasing pay and exploring multidisciplinary staffing models would help to restore timely oversight and enforcement. KABC recommends funding the competitive wages and innovative staff solutions. Number 4, to raise personal needs allowance. At $62, Kansas lags behind three of the 4 neighboring states and the $70 national average. Residents rely on the P&A for essentials like clothing and haircuts. Increasing P&A and indexing to cost of living adjustments would help residents meet basic needs. We recommend P&A increase and tied to future adjustments to the COLA. Number 5, to sustain a statewide resource guide for older Kansans. Last session's appropriation provides essential access to trusted care information statewide. Ongoing support of $150,000 annually would ensure continued availability both in print and online formats. KABC recommends requesting continued funding for this resource. These investments are necessary to protect access, dignity, and safety for older Kansans and to assure the state's long-term care system remains effective, efficient, and humane. Thank you for your time in considering these proposals.
Good afternoon. Sean Gatewood with KDADS Advocates Network. It's kind of difficult to narrow down with the breadth that the KDADS Advocates Network sort of tries to represent. So I'm going to stick with a couple of key items that have kind of our broadest support, and then refer you back to our written testimony. A couple of things that we have prioritized right now center around the waivers. Obviously, we're very interested in elimination of the waivers. There's been progress made toward elimination of these waiting lists, but now we have pretty deep concerns given the legislature's inaction toward the TA, FE, and BI waivers that we might be potentially heading for, wait lists in those, and I just believe that would be very near impossible to manage. So I'm hoping to see an increase in funding to prevent that from happening very shortly. We also want to obviously keep up progress and elimination of the existing wait lists, including the community support waiver. We are also interested in continuing progress on community care coordination, and that project keeps moving forward to support people living in their homes throughout the waivers that serves. The last but not least is we have always supported rate parity across all waivers. We just don't fundamentally see a difference in what a home. I'm having trouble finding my words today. A personal care attendant helping somebody with one disability versus another. We just don't see that as fundamentally different. And I will stand for questions at the appropriate time. Thank you.
Good afternoon, ladies and gentlemen. My name is Jason Barrett. I'm a self-advocate for Self-Advocate of Coalition of Kansas. I want to thank for taking the time listening to my testimony today. It is so important for people with disability to be part of this conversation about people with disabilities, nothing about us or without us. I'm here to talk to you about two issues. First issue, with numbers of people on the waiting list, IDD service and support. SAC would like to ask for increase the funds for the waiting list. Without services support, people with disability will have trouble changes, routines and just getting through day-to-day living. Or mental and physical health increase, unwanted behaviors, and actions for everyone else. Secondly, I would like to ask for a higher rate for employment services, increase numbers of support employment service. We appreciate KDAD working on leadership and IDD effort to take forward to change that have Kansas followed CMS rules, include the final rule. Thank you again, from Jason Barrett.
Good afternoon. I'm Rocky Nichols, Executive Director of the Disability Rights Center. I'll summarize our comments. We first recommend that you fund year 3 of the 5-year plan to eliminate the IDD waitlist. We included in our testimony the flyer that the DD Council and DRC did last year that talks in detail about that plan. Essentially, to accomplish year 3 of the 5-year plan, there's 3 critical steps. Step 1 is funding 500 additional slots on the IDD waiver, and at the same time lowering the IDD waitlist cap to 3,500. It's currently capped at 4,000. Step 2, fund 500 additional slots for the community supports waiver and begin the process of ramping up that waiver so that by fiscal year 29, that waiver can serve at least 1,500 individuals. And step 3, active management of the waiting list. Instead of the waiting list being a passive spreadsheet on a computer at KDADS, it should be an interactive portal. And the DD Council did a great job describing the importance of that and why that's so important to people with disabilities. It's also important to the state of Kansas. It's important to families as well. Because then information can be had in real time. People can verify where they're at on the waiting list. They can provide updates and information so that people are less likely to fall through the cracks. As part of that active waiting list management, in addition to the portal, KDAD should contract with CDDOs and Centers for Independent Living to conduct additional work with individuals who are on the waiting list, again, so they don't get lost while waiting. And KDAD should release an RFI for the creation of that waitlist dashboard portal and report back to the legislature on the results of that RFI. We also recommend funding 500 additional slots on the physical disability waiver in order to ensure the elimination of the PD waitlist. There's currently a $20,000 cap on the community supports waiver. That's a real problem and it needs to be removed. The community supports waiver is already capitated by the fact that we do managed care. Managed care capitates the amount of cost to the state on the community sports waiver. To add this second cap just hurts people with disabilities and it's not going to make it something that's going to be helpful like it's designed to. Finally, sufficient funding must be provided for the brain injury for elderly and TA waivers to ensure they don't have waiting lists. With my remaining time, I want to drill down on completing year 3 of the 5-year plan. First, we need to celebrate the progress that we have made, and KDADS has been integral and on the front lines of that progress during the first 2 years of the 5-year plan. Less than 2 years ago, when the DD Council and DRC and others started really focusing on this 5-year plan to eliminate the wait, the IDD wait list was at 5,400. Today, thanks to the new slots, the new funding, and the cap on the IDD wait list, it's now at 4,000. That's a monumental change. From 5,400 to 4,000, a 25% decrease in only 1.5 years. Another critical aspect to understand is that by eliminating the IDD wait list over the next 3 years, that when you do that, it is something that you can actually accomplish. We used to be, told that that's pie in the sky. We used to be laughed at, that the wait list was an unsolvable problem. And one reason why people incorrectly thought it was unsolvable is that we didn't have the data and the information to see how it could be solved. And now that we have that data, and thanks for KDADS for funding the waitlist study, we know that the vast majority of those on the IDD waitlist, 64%, according to the data, are youth under the age of 22. And in fact, nearly 50% of the IDD waitlists are ages 5 to 17. And that data indicates that a large percentage of the IDD waiting list apply several years in advance just so they have a slot when they either graduate high school or age out of high school at the age of 22. So the last recommendation is that you convene a group of stakeholders to look at ways to manage the wait list so that people get access to the services when they need them. I'm not saying you have to do what Virginia's done, but other states have done this to ensure that there's no waiting list for people who need IDD waiver services at that time. Thank you.
Hello, I'm Sean Swindler from the Kansas Center for Autism Research and Training and the Kansas Family Support Center at the University of Kansas Medical Center. We're probably over our quotas of Sean's in the room today. But we really appreciate being able to talk to you about our program and our request. Joining me in the room are Dr. Linda Heisman-Powell, our director, and our partners from KIF, Michaela Lawless and Kevin Bowden. KCARD has been a long-time contractor and provider of training and other services supporting KDADS waiver populations, including our critical workforce for kids with autism and IDD. For the last 2+ years, we've had the privilege of developing the Kansas Family Support Center, where we have a team that has developed a tiered approach to serving kids with autism and IDD who have significant acute behavioral support needs, and targeting kids involved in the foster care system and kids who may end up or be returning home from a PRTF. And so really what we're here to ask is to secure funding to extend and expand the successful program that we've developed in the Kansas Family Support Center. And we have a cost that we associated with that based on the work that we've done. And what we do is we want to provide sustainable evidence-based training and support services for families and providers working with high acuity youth with behavioral health concerns, including kids with autism spectrum disorder and other developmental disabilities. Often these kids are mostly going to be served on the IDD waiver, the SED waiver, and the autism waiver. And what we're wanting to do is to maintain this robust continuum of supports that we're trying to develop between our community for our community-based networks. That includes feedback-informed decision-making, implementation science to ensure fidelity, and of course the work that we're doing is evidence-based, research-based to support this population. And what we're hoping is that if we can more permanently support this ongoing project, we'd be able to reach out to over 800 caregivers and families every year to provide this really needed support. And so what does that look like? We have tiered supports available. One is our tier 1 is universal training. For the past 2 years, we've been doing echoes and webinars on how to serve this population, including targeting kids with IDD, autism, behavior, and other support needs that kids may have, reaching out to both parents and professionals. 2 is training. We have a robust training system that's been in place for 15 years, including our OASIS provider training to support providers to work with this population. Our OASIS parent training, which is a parent training program that's now insurance billable. So parents who have kiddos that need more behavioral supports can receive coaching and training through this system. And then we've also developed specialized supports to target families who may be struggling and may have their child go to a PRTF or may be in danger of their child going into foster care. And so that group, that tier 3, we want to continue doing this intensive wraparound facilitation for this population. That includes continuing intensive services when families reach out to us and say they're struggling, or a provider or a case manager reaches out to us and says this family really needs additional support. That could include support for the parent training, could include our BCBAs that we have on staff that can outreach. It can include coordinating a community ABA, BCBA provider that could come into the home. One of the things that's really tough for families, especially in crisis, is to locate that provider and to understand all of the things that go into even Medicaid insurance billing. And those are things, the kind of support we can provide to families to help coordinate that. And we've been developing that network and that resource database. Our partners in KIFIC are going to offer training opportunities for professionals to become endorsed wraparound facilitators and implementation coaches in partnership with human service agencies. And KIFIC, in partnership with KFSC and our other collaborators, assist with treatment and procedural fidelity tracking, outcomes monitoring, and other quality indicators. One of the things that we're missing in our state is data. And so what we would like to do is bring some data focus to serving this critical population. Finally, we're going to be doing Sustainable Community Support Network led by KCART and KFSC and supplemented through KIFIC systems coaching and evaluation. Ongoing engagement that we've already been doing as part of KFSC with CDDOs, CMHCs, PDRTFs, and other common providers, and continuing to work on establishing billing codes that can make this work sustainable. Sometimes our billing codes don't match the kind of work that needs to be done to provide behavioral supports in the home. Finally, we heard about workforce earlier. Our training is a critical piece of supporting workers that are going to work with these high acuity populations. And we've again been doing that training for 15 years. And KIFIC is also going to be working with us to provide endorsement for at least 30 new wraparound facilitators throughout the state. And finally, this is a critical component for kids who are accessing services and supports through EPSDT. And we'll have answer questions later. Thank you.
Secretary Howard and KDADS leadership, thank you for the opportunity to discuss with you how KDADS can continue to support employment first efforts here in Kansas. My name is Craig Knudsen, Executive Director for the Kansas Commission on Disability Concerns. As you know, Kansas was the first state in the nation to adopt employment first legislation in 2011. Unfortunately, after more than a decade, the commitment and the promise of employment first still isn't an everyday reality for Kansans with disabilities. Since the implementation of Employment First in Kansas, competitive integrated employment outcomes for Kansans with disabilities have decreased significantly, whereas nationally employment outcomes have improved marginally. As a result of this decline in employment outcomes in Kansas, the state currently ranks 47th out of 51 states, including the District of Columbia, for the percent of persons participating in integrated employment services as of 2022. However, I am happy to report that Kansas has begun to see some glimmers of hope that we as a state can fulfill our promise of employment first for Kansans with disabilities. In 2023, KDADS awarded a grant to the KU Center on Disabilities and their grant partners to create a comprehensive, fully executable statewide plan for the implementation of Kansas Employment First law. Part of this action plan was the creation of a pilot project. And in this pilot project, 4 providers were selected to receive ACRE accredited training and were also paired with a mentor organization that had already made the transition to increase capacity for competitive integrated employment supports. As a result of the pilot project, Kansas saw a 179% increase in the number of ACRE certified employment support professionals in 2024 versus the previous 4 years combined. It was believed that increasing the number of ACRE certified professionals would lead to more Kansans with disabilities engaging in competitive integrated employment. Going into the grant, it was projected that 20 Kansans with disabilities would obtain competitive integrated employment because of the pilot project. I am happy to report that as of June 1st, 2025, 170 Kansans have obtained those competitive integrated employment outcomes, representing 850% of initial projected outcomes. Of those obtaining employment, the average wage was $13.68 an hour, almost double the state minimum wage, and the average number of hours worked was 22 hours per week. Unfortunately, funding for the project tentatively ends on December 31st, 2025. We recommend that KDADS secure funding for the long-term sustainability of the Kansas Employment First Training and Technical Assistance Center as part of its budget requests going forward. Sustainable funding for this project would allow for statewide training of employment support professionals across disabilities and across service systems. This would ensure that no matter how an individual with a disability in Kansas entered into the disability employment system, whether it be through waiver support, whether it's through vocational rehabilitation, the Kansas workforce system, working healthy programs, certified community behavioral health centers, or transitioning from high school into adult services, they would have access to professionals who've obtained skills and core competencies to provide supports that lead to successful employment outcomes. Increasing capacity to provide high-quality employment supports pays for itself through the economic empowerment of Kansans with disabilities and through reduced Medicaid claims as a result of engaging in competitive integrated employment. People with disabilities who are engaged in employment have expanded economic freedom, live healthier lives, and have a higher quality of life where they're engaged in meaningful activities in their communities. This translates into more economic activities in local communities and lower overall Medicaid costs for state and federal governments. Sustaining and replicating the training and mentorship opportunities provided by the center would also favorably position Kansas to take advantage of potential federal funding for long-term sustainability through the recently reintroduced bipartisan-sponsored Transition to Competitive Integrated Employment Act of 2025. This act authorizes $300 million in grant funds to assist states and providers to transition towards competitive integrated employment. We know how to increase employment opportunities for Kansans with disabilities. It is imperative that we continue to move forward and not backwards by increasing capacity for high quality supports and services in our shared quest to support and implement Employment First in Kansas. Thank you for the opportunity to talk with you today and for all that you are doing to help turn the promise of Employment First into a reality for Kansans with disabilities.
Well, hello, everyone, and thank you, Secretary Howard, for giving us the opportunity to speak to you today. I know that you've done this for several years. It is definitely a privilege to come and do this and appreciate your teams soliciting this input from advocates and people in Kansas. So I'm Mike Burgess, and I'm a member of the organizing committee. Today, I'm not wearing my DRC hat. I'm wearing the Big Tent Coalition hat. So appreciate the opportunity to speak to you today on behalf of all the Big Tent Coalition members. Like previous speakers had talked about, we do want to encourage you to pursue year 3 of the plan to eliminate that IDD waiting list. And want to thank you and your team for their leadership in getting us to this point. I mean, it is, as Rocky had said, and the KCDD folks had said, I mean, this is a huge measure of progress, and you do have to sit back and appreciate how much progress we've made from where we were. It gives a lot of the families hope, and we want to continue to urge you to continue making progress there. The Big Tent Coalition does have 5 recommendations for the next budget year. In that first one, we want to encourage you to work with IDD stakeholders and self-advocates to re-envision the way you track the waiting list. I think there's a huge opportunity there, and I think bringing together those groups to have a process would be the timing is right to have that, to take that opportunity. The second recommendation would be to appoint a task force of self-advocates and stakeholders to work with you on recommendation 1. And make sure that we do continue to do year 3, 4, and 5 and get to no waiting list. The third recommendation would be to increase the PD waiver and IDD waiver by both 500 slots for each. We think that you again, making progress to eliminate that IDD waiver waiting list, and then with a few more slots on the PD, we could get to having no waiting list, which would be amazing to get back to that point. The fourth recommendation would be to fully implement the community sports waiver and have it start during this fiscal year and ramp it up to 1,000 over the next fiscal year. That's going to be a key part of that, getting to 0 on the IDD waiting list. And a subset of that recommendation, as Rocky had said and others, we're really concerned about that $20,000 cap on that community sports waiver, with that being stuck in time. We know that's not your choice, that's part of the thing, but we want to encourage, as you're making those funding recommendations, that you do ask the legislature to take a hard look at removing that $20,000 cap. And our fifth recommendation, and it's not new, you've heard from other folks, is to make sure that we don't start additional waiting lists on the other waivers. We were relieved to hear, at least in the short term, that the TA and brain injury waivers are not likely, you're not having to pursue that right away, but obviously it's a big concern on the FE waiver within the current year. And so when we look at both the supplemental within the current year and make sure that we all want to advocate for that, to make sure we don't start waiting lists for the other waivers as well. So with that, we appreciate your consideration of the Big Tent Coalition's requests and priorities, and would be happy to stand for questions at the appropriate time.
Good afternoon, Secretary Howard, members of the KDADS committee, stakeholder leaders present today. My name is Molly Edwards Workman. I'm Senior Vice President for Foundation Mission Services from Envision. Thank you for the opportunity to submit our request for funding, and we appreciate the time to speak with you here today and provide testimony. So for those of you that may not know, Envision, the mission of Envision is to improve the quality of life and provide inspiration for people who are blind or visually impaired through employment, outreach, rehabilitation, education, and research. And what you also may or may not know is we are the only organization in the state of Kansas that does what we do, provides that full range of items that we just shared with you for our families, our friends, our neighbors, our colleagues, from all ages, birth to seniors, and we provide those to individuals from all the borders of the state of Kansas, regardless of their ability to pay. So we say that because we appreciate the partnership and all the support we've had from KDADS in the past to allow us to continue to do that for all the individuals that live in this great state. So I'd like to introduce Teresa Houston, so our Director of Envision Child Development Center, to share some testimony with you here today on the direct impact that she and her team have on families here in the state. So Teresa.
Well, thank you. Thank you, Secretary Howard and committee. I am just so humbled and proud to be here today. I am a student of Envision, a patient of Envision, and I've been employed with Envision for over 15 years. With this, I didn't come totally blind at first, but now I'm totally blind. And I feel so empowered. I'm so proud to be a part of Envision. We are the stability and the consistency of the blind community. These are some of the things that we deal with. There was a set of twins born. One was sighted, one was blind. The little boy is sighted, the little girl is blind. The nurse called the hospital, the hospital called the clinic where Jessica works. And the clinic called me. This nurse was in a panic because she didn't know how to support this mom of this blind baby girl. And I told her, now is the time to be blind. And I said, I want you to give her my name and number and let her know we have so much assistive technology. We have so much support for this family. But now is the time, the way technology has moved. I used to get books on tape and CDs. Now we can just download a book and make it through college. I'm Cali County Associates, Newman University Bachelor's, Friends, totally blind, now's the time to be blind. And I just appreciate your support of Envision throughout the years, but we are here to support disabilities. We have dealt with blindness and autism within our center. We want our students to have positive early childhood experiences that can support them through their adulthood. Thank you again for your time.